Well, hi, and welcome to Flashpoint. I'm coming to you from my home this morning. As you perhaps have heard, I have tested positive in the past week for the coronavirus, and my house is the only one where COVID managed to work its way through the nooks and crannies, under the doors and windows. It also happened at Governor Whitmer's house, and the governor is good enough to be my guest today on Flashpoint. Governor, I appreciate your time. I know you're kind of in self-isolation. First off, how's Mark, your husband, doing, and how are you feeling so far?
Well, like you, Devin, he was vaccinated and boosted, and so his experience with COVID has been pretty mild. Yeah. And I continue to test negative. So this virus is, it's unpredictable. It is everywhere, it seems like right now. And so the best thing anyone can do is to stay out of the hospital. And the way to do that is to be vaccinated and boosted. And I'm glad that my husband is, and hoping more of your listeners who maybe aren't yet will get so.
Well, as you and I are having this conversation, we arrive at a moment where now Michigan is seeing for the first time over 20,000 cases a day. It's a pretty alarming level that we've arrived at this deep into the pandemic, and yet you have continued to resist changing the orders or the way that we address the pandemic at the moment. Explain your reasoning a bit.
Well, I think it's important to recognize that in March of 2020, when this virus first showed up, it was devastating. It was taking lives. It was spreading. We didn't know a lot about it, much less have the tools we needed to stay safe. Obviously, these numbers are concerning, and I worry really about those who are immunocompromised or our youngest citizens who can't yet get vaccinated. But every one of us, every one of the rest of us, has the ability to avail ourselves of a vaccine. We know that wearing a mask is the best way to stay safe when we're out and about. And so we have tools now that we didn't have before. And I think it's important to continue to make those tools available, to encourage people to get vaccinated so we can keep our economy growing. We can keep our kids in school and safe. Every one of us needs to do our part here. And if we do, we're going to get through this all right. And so it's incumbent on all of us to take the action that we can, that we now have, that we didn't have a year and a half ago.
We clearly do have a lot of tools at our disposal we didn't have before, but the numbers are what they are. And when you have hospitals like Beaumont this week saying that we're at a breaking point, and they've got themselves thousands of, right now we've seen thousands of healthcare workers now have COVID as well. If we're reaching a breaking point, is that not the indication that it's time to do something differently?
We have been working very closely with our hospital leadership all across the state for the better part of these 2 years. I know that our hospital workers, the doctors and nurses and respiratory therapists and everyone who works in our hospitals, they are exhausted. They've been breaking their backs to take care of the rest of us, and they put their own health on the line to do it. What we need is the people of the state to take some personal responsibility and get vaccinated, to get boosted if you've not yet been boosted and are eligible to be. This is the best way to relieve the strain on our hospitals. We all rely on our hospitals. We want to know that if we have a car accident and show up at the ER, we're going to be able to get the attention we need. And right now, that is really in question in hospitals, not just across Michigan, but across the country and frankly, around the globe. This variant is spreading so much faster. And while it may not be as deadly, depending on how you look at it, you still get a bigger proportion of people showing up at our hospitals. And that's why getting vaccinated, getting boosted, giving our hospital workers a little bit of relief and making sure that there's a bed available when those of us need it is something that each of us has to do our part to make sure that happens.
I'll assume, though, that you won't preclude maybe having to change course in the future if something happens.
You know what, Devin, I think it's always important to keep all of our tools as a possibility. At this juncture with this virus, we've got individually tools to take action to keep ourselves safe. There are a lot of people who have cut back on their social interactions, who are wearing their masks and good fitting masks and 95 masks when they go out and about, and have been vaccinated and boosted. These are the actions that each of us should be taking to keep ourselves safe and to collectively do our part to keep our hospitals from being overwhelmed.
We've had the president's plan to try and to order large employers to mandate vaccines now argued in front of the Supreme Court. There's been some confusion as to whether or not you think that's a good idea or a bad idea. Where do you stand right now on a mandate for big employers?
I support the president's actions. I think what the confusion stemmed from a conversation I had with a lot of employers who are worried that they don't have enough employees to do the jobs that they currently need. And they're worried that a mandate will mean that they'll have people leaving when they actually need to be bringing people in. And I was acknowledging that that's a very real concern. It's a concern for us as a state. We have 50,000 state employees. They mirror the public, and certainly there are some who are not yet vaccinated, and a mandate will create some of those stressors in state government as well. And that's simply what I was relaying. I never undermined or questioned the wisdom of the move. I just recognize it's going to be hard for us.
Yeah, you said it could be a problem. I want to move into a couple of other issues here because I guess this is typically the time of year you would be talking about a state of the state address. Have you made any plans yet toward that and how it should be done this year?
I think in the coming days, you'll see kind of what our plan is. We know with the COVID situation, it's probably not wise to convene everyone in person in the traditional sense. Second year in a row that is the case, but we'll be nimble. And I've been having conversations with leadership in the legislature. I think we'll be able to announce something early in the week.
We've got clearly a very changing playground right now for politicians all over the state with what's happening with redistricting. Give me your thoughts on the maps as you've seen them so far, where your concerns are with how we arrive at those, because you have talked about perhaps some open meetings violations that the commission may have committed. Where do you stand on the redistricting as we've seen it?
Well, I do think that after decades of gerrymandering in Michigan, this Voters Not Politicians initiative was really an important move for us to ensure that we've got legislatures that represent the people as opposed to picking the people that they represent. Certainly, this is our inaugural time going through this citizen-led effort, and there were growing pains to be sure, and we're all sussing out where all those lines fall and what they're going to mean for the bigger picture. But I do think that this is an opportunity to ensure that we do have transparency and that it's the people's will that is reflected in the outcome. And I think that this is positive in a lot of those regards.
It seemed to many that you and a number of other leaders in Lansing were kind of blindsided by what Ford announced last year and where they were going to be taking their battery plants down south. You described it as being a problem of a dysfunctional economic strategy. If this was your first year, I guess you could blame somebody else, but as you're in it's not your first year. Do you own some of that?
I think, well, clearly, first, let's start with this. We understand Ford and the decisions they made, and a lot of them had nothing to do with the state of Michigan. It was a bigger, I think, decision that there were a lot of factors that went into it. One of the things we know, though, is that for decades, Michigan has been considered a state that doesn't have the sharpest economic tools, that we are slow. Lansing can be dysfunctional at times. And I think that's why it was so important that we work together, business community, the legislature, my office, Republicans, Democrats, labor, we all work together to make sure that we created sharper economic development tools. We moved fast and we worked together. So we dispelled that old narrative and showed Michigan is serious. This is a place to invest, and we are going to be a place that does cutting edge manufacturing and solves the world's problems. And so we now have those tools to do that. It was a great bipartisan victory, and I'm really pleased, and I think it's going to inure to our benefit. I think we'll see the fruits of that labor soon.
Governor, I could ask you a million more questions, but I'm afraid I got to get to a break. I wish you keep avoiding the coronavirus as best you can. Best wishes to your husband, Mark, and we'll talk to you again soon, I hope.
Thank you. I look forward to it.